My name is Maria Walsh, and I live in Kansas City with my husband Matt and my 3 children, Oliver that lives in heaven and Elsie and Miles that live here. I found out I was pregnant on January 31st of 2014, and it was the best day that I could ever imagine. My pregnancy was flawless. It was one of those picture-perfect pregnancies. I did not have any complications. At our 20-week scan, we learned that we had a healthy baby boy. We set up our new nursery for him and washed all of our baby clothes. We were ready to have that dream pregnancy and welcome that baby into this world that we had been hoping and dreaming for our whole lives. About 3 weeks before Oliver was born, I noticed that my movement had changed. For those 3 weeks, I had spoken up to my providers to let them know that his movement had changed, and I was told things such as, "You are just a first-time mom, don't worry, don't have anxiety." I was told to lay on my side, to drink something cold. I was also told that babies run out of room at the end and that he was probably just getting ready for delivery. I know some of the myths that now are known to be false are any of those interventions to make your baby move. I know that I should not be eating something sweet, laying on my side, drinking something cold. I shouldn't be trying to make the baby move because the baby is trying to tell me that they may be in distress. I was 38 weeks and 2 days pregnant when we thought we were going in to have our healthy baby boy. We went into the ultrasound room and we were told those dreadful words, that there was no longer a heartbeat. When you go in to think that you are having your healthy baby, and those are the words, you can only imagine what you go through. We had to go through labor and delivery, knowing that we would deliver a lifeless baby. It was the worst day of our lives, something we will never forget. I knew the second that I saw Oliver that he was a healthy baby and there was nothing wrong with him. We later learned from research that Oliver had growth restriction at the end, and he was telling me for 3 weeks that he was struggling. I deeply wish that when I spoke up the last 3 weeks of my pregnancy that I would have been listened to and taken seriously. Because if somebody would have said to me, "What are you feeling?" I was not feeling Oliver inside of me. I was feeling lumps on the outside of my belly. If one person would have asked me those open-ended questions of what are you feeling, I truly believe we would have delivered Oliver 3 weeks earlier. Count the Kicks is an evidence-based stillbirth prevention program. It is aimed at expectant parents to monitor their baby's movement in the 3rd trimester. Our overall goal is to lessen these stillbirths in the United States. It empowers expectant parents to be able to speak up when they notice a change in their baby's movement in the 3rd trimester. The app is very simple to use. What you will do is find about the same time every day that you feel that your baby is most active. You'll go ahead and you'll start to track your baby's movements, any kick, jab, push, roll, and you'll start to tap the little foot on the app for each movement. You're going to find 10 movements as you are sitting during that session, and you'll track each of them. At the end of the session, it will ask you to rate the baby's strength from fluttery to fierce. After that, you will end your session, and it will start to make a little graph for you for each day. You can see about how many minutes it takes for you to get to the 10 counts. After a few days of tracking your baby's movements, you'll start to find your baby's normal and about how long it takes for them to get to 10 kicks. If you notice a change in that movement and you notice it's taking them longer to get to those counts, we want you to speak up immediately to your providers. Guidance from recognized national organizations such as American College of Obstetricians and Gynecologists and Association of Women's Health Obstetric and Neonatal Nurses recommends all expectant parents to actively monitor their baby's movements in the 3rd trimester. We know that at least 21,000 babies are born still a year. That is a school bus of children a day. 60 kids a day are stillborn in this country. And we know that at least 1 in 4 of these stillbirths could be prevented. In Iowa, where Count the Kicks first started, Iowa saw a 32% reduction in their stillbirth rate in the first decade of their Count the Kicks public health program. Our vision is to make this same impact in all 50 states, which would result in saving at least 7,500 babies per year. Nothing will ever bring Oliver back, This has given me a way to process through my grief and a way to take this tragedy and act. If I can just save one family from going through what we go through every single day, it's all worth it.